Hi everyone, it's Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who was referred from an audiology colleague of mine, and they attempted to perform earwax removal in this ear. They did manage to get a little bit of wax out laterally, but from here on in, as soon as they touched the wax, the patient found it too painful, and my colleague struggled to therefore perform the procedure and recommended they visit myself. So the patient made the journey to visit me, and as soon as I again touched the wax, there was a bit of discomfort there, and the patient attended with otalgia, so earache, prior to me performing any procedure. So immediately in my mind, I was suspecting Keratosis obturans. So Keratosis obturans is slightly different to earwax. Earwax is an amalgamation of three organic compounds. 60% there or thereabouts is made up of dead skin, and the remaining 40% is made up of sebum, which is a lipid, oily secretion, the same secretion found on our scalp, and an oily sweat secreted by the ceruminous glands in the ear. Keratosis obturans is purely dead skin, dead keratin. And with Keratosis obturans, one of the landmarks, one of the clinical symptoms of Keratosis obturans is otalgia, earache. It's not to say that if someone has earwax that they don't suffer from ear pain as a result from the earwax impaction, but with Keratosis obturans, it's very unusual for someone to have grade 1 and above Keratosis obturans without experiencing otalgia. So in my mind, this patient was experiencing and suffering from Keratosis obturans, and it transpired that they did. Sometimes it's very hard to distinguish between the two because Keratosis obturans and earwax can look very similar, but it's more to do with the consistency. Keratosis obturans, either you get dead skin that's really elastic and springy in the ear and soft, but it's strongly adhered into a matrix and it's attached itself to the canal wall, or you can get rock hard keratin, and this is what this patient's got. They've got rock solid stone-like keratin, and there's a grading system of Keratosis obturans. So grade 1 is when there's some mild pain experienced by the patient, but no discernible expansion of the ear canal. So this skin plug that occurs with Keratosis obturans, it gets bigger and bigger and bigger, and it has so much force and pressure that it starts to widen the bony part of the ear canal. And considering the temporal bone, which is the bone that encases the ear canal, is the second strongest bone in the body behind the femur, you can just imagine how much force and pressure the skin plug must have in order to start to widen the bony part of the ear canal. So grade 1 is some earache and no discernible expansion and widening of the ear canal. Grade 2 again is ear pain but mild expansion of the ear canal. Grade 3 is quite moderate to severe pain and moderate expansion of the ear canal. And grade 3, typically you get granulation tissue. So granulation tissue is, if you like, inflammatory tissue. It's a buildup of a connective tissue that has its own blood supply and is present in the healing process. So if you've got a wound, for example, quite often you get a buildup of granulation tissue. And granulation tissue is characterized by a rough surface, a bumpy, moist surface, and you can actually see the blood vessels within that. So this patient, they've got ear pain, and you will see they have got, I would say, mild to moderate expansion of the medial part of the ear canal, so very deep in the ear, and they have got granulation tissue. And quite often with grade 3 Keratosis obturans, when you starting to remove the Keratosis obturans, you do get some what we call contact bleeding. Because the skin detaches from the connective tissue, some of the blood vessels rupture within the connective tissue, within that granulation tissue that I discussed, and you get a bit of contact bleeding, and you'll see that, you probably did see that already. So the instrument I used there was a Cawthon hook, so I'll come back to that, but on the left-hand side, I don't know if you can see, there's a bit of swelling, there's some flesh-like material, and this is all granulation tissue. And we're actually suctioning some of this away. There is also some inflammation there, but you can see some granulation tissue. It's kind of a bumpy red surface, and you can almost see the blood supply there. So, and another clue that this patient's got keratosis obturans. This is all dead skin. This is forming the perimeter of the skin plug. Now, we haven't quite finished. You may think we have, but we haven't. I know we can see the majority of the eardrum, but this skin plug now extends superiorly. So the very deep in the ear canal, that section of the ear canal in particular has been widened. So you might have just seen that that's granulation tissue that I've just removed. So it's like a flesh-like tissue. There's some dead skin here, but you'll see in a moment the top part of the ear canal, the roof, the attic region of the ear canal near the eardrum, that's it, that's widened. And you've got this plug of dead skin also growing up in there. And the skin around the edge, that's white, so that's freshly dead skin from the ear canal that's been replaced by another layer of skin. And that skin forms part of the plug, and eventually that skin will compress, come more central to the core of the plug, and it will oxidize. You can see the colors there. The skin furthest away near the ear canal, it's a light shade, and as it goes downwards, it gets darker, so it's oxidized. So I'm just using the fine end. We want to remove this from the front part of the ear canal. Now, in terms of the grading system, so this is, I would say, a grade 3, grade 2 straight grade 3. A grade 4 is quite severe. I've seen one before and I've had to refer straight to ENT because I need surgery for that. It was quite extensive, and grade 4 is the widening of the ear canal is so expansive that the bony part of the ear canal, it merges with the mastoid bone. So the mastoid bone is the bone behind the ear. You may have seen some of our videos when we've talked about a mastoidectomy, a radical mastoidectomy, so a canal wall down mastoidectomy, and that's when the mastoid bone is drilled away because it's infected, and they continue to drill it into the ear canal. So the ear canal, the posterior canal wall, the back portion of the ear canal wall has been drilled away as well. So the mastoid bone and the ear canal become one, and that's what a grade 4 keratosis obturans looks like. It's quite severe. It's excruciatingly painful for the patient. They need to have that typically performed under general anaesthetic. So I'm just going around the perimeter, trying to get some dead skin. So my colleague did the right thing by referring, because it's a very difficult procedure, keratosis obturans. It's one that I do quite a lot, one that I enjoy as well. They are the most challenging. I've got a playlist on my YouTube channel. In comparison to some of the other keratosis obturans procedures, this was relatively straightforward in terms of the time taken, but it was complex because of the pain. Now, when the patient experiences pain, it's always difficult because we don't use any local anaesthetic. As an audiologist in the UK, we're not able to administer any local anaesthetic. Well, I hope you enjoyed that video, guys. Take care, keep well, speak soon, bye.